Next up, we have from the Department of Health Administration, please welcome Laura Cole.
Health is a human right. This is what the World Health Organization told the world in 1946. Health is a human right, they said, and governments are responsible for making sure that their citizens have that right. And the rest of the world said, okay. And thus the origins of the universal healthcare system were born. Now, Canada was one of those countries that said okay, except it didn't sound like okay. It sounded like the Hospitals Insurance and Diagnostic Services Act of 1957. And then in 1984, they cleared their throat and said, actually, we meant the Canada Health Act. And that's the legislation that's still in place today that governs our healthcare system. But the World Health Organization, not ready to be done the conversation, was like, hey, Canada, how's it going with that healthcare system? And Canada was like, it's going so well. We cover all hospital visits and doctor's fees. We have healthcare for all Canadians. WHO was like, so glad to hear that, but just a couple more questions. Are you sure that all the people who need healthcare are getting it? And Canada was like, what? And so the World Health Organization explained, it's not just about having a healthcare system. It's about making sure that the people with the most health needs are getting the care that they need. Because there are lots of different things that affect how much healthcare we need. Things like our age, our sex, where we live, what we do for a living, and the big one, our income. Because as it turns out, the people with the lowest incomes have the highest healthcare needs. So it's not just about having a healthcare system, the WHO said, it's about making sure that the people who really need the care are the ones who are getting it. And Canada was like, huh, and they set some research priorities. My work looks at the probability of GP, specialist, and hospital use in Canada based on income after controlling for need. Now, the Canada Health Act says that healthcare in Canada is universal and accessible for all Canadians. But my preliminary results show that it's not. You're more likely to see a specialist if you have higher income, regardless of your healthcare need. The same is true for GP use. In contrast, you're more likely to spend a night in hospital if you have low income. Now, here in Canada, we're built on the idea that all people have equal rights and opportunities. But my work is showing that not everybody has the same opportunity to health. Not because of an underlying medical condition, but because of how much money they make. Now, this is pretty much the definition of social injustice. But before we can find causes or create policies to try and fix this issue, we have to know exactly what's going on. And that's what my work is. Thank you.